name is Colin. I'll be your nurse for today. Are you able to tell me your name and date of birth?
On that January 15, 1990.
All right, what language do you prefer to speak in?
English.
All right, and are there any cultural or religious restrictions that I should be made aware of?
No.
All right, and at the end of the assessment, I do have a health literacy brochure. Would you be able to read that? Would you have any trouble?
No trouble.
Okay, so one on the health literacy. So the patient's height and weight are proportional, dressed appropriately for the weather, and the hygiene is appropriate. No involuntary movements, is able to maintain eye contact appropriately. The body language and facial expressions are appropriate. Anxiety level is appropriate, and the mood and affect is appropriate as well. So what brought you in today?
I just my annual checkup.
Okay. Do you know the date?
April 16, 2018.
Do you know what time it is?
It's 6:30.
All right, and do you know who you are?
On that.
Do you know who the president is?
Trump.
The president before him?
Obama.
All right, so the patient is awake, alert, and oriented ×3. The speech is clear and the memory is intact. Okay. Have you experienced any headaches or dizziness lately?
No.
Okay. All right, so I'm going to go to the cranial nerves. So if you could just cover one eye and read the third line.
T-O-Z.
All right, now do it to the other one.
T-O-Z.
Okay. So now I'm going to assist the eyes. So if you could just look straight forward to the wall as I come in. Okay, now we're going to do the other side. Okay.
Sorry.
So now what we're going to do, all I need you to do is just follow the top of the pen light and just wet your eyes, okay? Okay, now where it says for accommodation. Yeah. So now what we're going to do is we're going to do with the cotton ball, so the blink reflex, so blink reflex is fine, so we're going to do facial sensation, so close your eyes and just tell me if you feel this.
Yes.
Where do you feel this?
Yes. Chin.
Alright. So what we're going to do now, just look, and I need you to close your eyes really tight, raise your eyebrows, smile, frown, puff out your cheeks. Okay, so now we're going to assess your gait, so I need you to stand up, walk to the wall, and then you can sit down. Now we're going to do the whisper test. So all I need you to do is just cover one ear, and let me know if you hear this.
1, 2, 3.
Right, now do the.
ABC.
Okay. So what I need you to do is shrug your shoulders and move your head to the side. All right, now I need you to stick out your tongue, move it side to side. Okay. And I need you to open your mouth real loud, say ah. Okay. Now I'm gonna have you swallow and say okay.
Okay.
All right. So now we're gonna do the eyes. So have you experienced any visual changes or itching to your eyes? Okay. So I'm gonna have you pull down your eyelids. All right. And the conjunctiva is pink and moist. The sclera is white, and there's no drainage noted. So I'm gonna look at the ears. Ears look fine. They're bilaterally symmetrical, and there's no drainage from the ears. Have you experienced any hearing loss lately? Any problems with balance? No? So now what we're going to do is the nose. So have you experienced any facial pressure or congestion lately? Okay. So we're going to look to see the nose. The nose is symmetrical. There's no drainage. And the nares are not flaring, so I'm going to have you we're going to do a sniff test for nasal patency. So I need you to close one nostril, sniff out of the other, and vice versa. Okay, so the nose is bilateral and nasal patency. So now we're going to do mouth and throat. I need you to say ah again. Let me see your teeth. Okay, so the teeth are white, smooth, and intact, and the buccal mucosa, the lips, the tongue, and the gums are all pink and moist without any lesions. So have you had, a sore throat or anything, or maybe dental pain? No? All right. And have you experienced any chest pain? Have you experienced any chest pain or any shortness of breath? All right. So I'm going to assess for JVD. Okay. So I need you to move to the side and look. And there is no JVD noted. Alright, so the facial skin and the lips are appropriate and normal for the ethnicity. There's no flushing or cyanosis or any pallor to the skin. We did the JVD, so the lower extremities, they are bilaterally symmetrical. There's normal hair growth and color, and there's no lesions, no ecchymosis, normal in color. So now what I'm going to do is I'm going to listen to your heart. Do it apical pulse. All right, you can just lift up. I'm going to do it with the diaphragm for 1 minute. Okay. So between 60 to 100, raise normal, regular. Now I'm going to do the other ones. So with the diaphragm, apical, pulmonic, Erb's point, tricuspid, and then mitral. Now I'm going to flip to the other one. Listen to murmurs on the bell. Mitral, tricuspid, Erb's, pulmonic, and apical. Okay, and they're normal in rate and rhythm. So now I'm going to do the pulses. So what I'm going to have you do, I'm going to do the carotid. If you have your hands out. The radial pulse, we're going to do it bilaterally. All right, now we're going to do the brachial. Going to go on the inside of the arm. Okay, then we're going to go down back of the kneecap, popliteal, posterior tibialis. You can see that. All right, and then the dorsal pedialis, right there. All right. So all the pulses are bilaterally equal, +2 and regular. So now we're going to assess for capillary refill. So if I could just see your fingers, we're going to do the very tips. See your other one. All right. Down, tips. This one. Okay, and they are all less than 2 seconds for capillary refill. We're going to assess for edema. No edema, and there's the temperature in both lower extremities are the same. So now we're going to do respiratory. So have you experienced any wheezing, prolonged cough, shortness of breath or anything? Okay. So the breathing pattern is regular. There's no use of accessory muscles. So what I'm going to do is I'm going to do diaphragmatic expansion. So if you could just come up. All right. All I need to do is take a deep breath. All right, so the diaphragmatic expansion was symmetrical. So I need you to turn around. Tactile fragmentus, just say 99.
99.
Turn around.
99. 99. 99.
Normal vibrations. Listen into lungs. You just turn around.
I'm sorry.
All right, so for all these, I want you to take a deep breath, say 99E, and whisper 1, 2, 3, okay?
99 E 1 2 3. 99 E 1 2 3. 99 E 1 2 3. 99 E 1 2 3.
And have you turn around.
99 E 1 2 3. 99 E 1 2 3. 99 E 99 E 99 E 99 E.
All right, so you can sit down. So the lungs are clear to auscultate, and the lungs are negative for egophony and bronchophony and whisper pectoriloquy. Okay. So now what we're going to do is I'm going to have you come up here. All right, and you could just lay down. So we're bringing your stomach out. All right, so the stomach is round in contour and it's symmetrical without any striations, rashing, or lesions. So what I'm gonna do now is first listen to your stomach. All right. Okay. So there's normal sounds in all quadrants of the stomach, so I'm going to palpate your abdomen. Just let me know if you have any tenderness. Any tenderness?
No.
No tenderness, and I'm going to palpate your bladder. All right, bladder is non-palpable, so you can put your shirt down. So what I'm going to do now, have you experienced any heartburn or constipation?
None.
Any joint replacements or any lack of balance?
No.
Okay, so what I'm going to do now, you can lift your leg up. If you can bring it that way, bring it toward me. Okay, now I need you to resist. Resist this way. Now we're going to do it the other one. Bring it up, bring it toward me. Other way. All right, now resist. Resist. Perfect. All right, now you can just swing around. Okay, so what I need you to do, bring your hands up and bring them down. I need you to bring your hands, do it like that. All right, so resist, resist. All right, put your toes up, put your toes down, now resist. Resist the other way. Okay, so now we're gonna assess for lordosis, kyphosis. So there's no kyphosis, no lordosis, and no scoliosis. Okay. So the range of muscles is, the muscle strength is a 5 out of 5. Okay. So now what we're gonna do is skin, hair, and nails. So the skin is normal. Have you had any rashes or any like itching to your skin?
No.
Any lesions?
No.
The skin doesn't have any lesions. The hair is nice. Let me see your nails. There's no clubbing in the fingertips. The hair is evenly distributed. So then we're going to do the hygiene is intact for the patient. The nails are not dry, not brittle at all. And then the skin is moist, warm to the temperature, bilaterally equal, and the turgor is normal for the patient.
Breathe.
And the posture for musculoskeletal, the posture is erect and the shoulders are equal in height. All right, and we're good.
You okay?
Yep.